For a person with memory or cognitive problems, I cannot emphasize the importance sufficiently of talking to the family or to patients' friends or workmates. At risk of stating the obvious, if the patient truly has a memory problem, they can't describe it. They cannot give you an accurate history. So you really need corroboration from family. Of course, we all have memory difficulties from time to time, going upstairs, not remember why, starting a sentence, can't remember how to finish it. This is normal, but it worries patients sometimes. You have to get away from that sort of thing. Oh, I forget people's names who I'm talking to. We all do that. What you're looking for is a history of disasters, things that have gone badly wrong, getting lost and having to ring up and find directions, having to go to the police station to find out where you are. Going out in the street without the right clothes on, stuff like that, going to work on the wrong day, things really going wrong. That history from the family is very important, and looking at a change in the patient's ability, changing what they do. He used to be so active, now he stares at the wall all day. That's all very important. Then when it comes to examining the patient themselves, the first thing you need to do is make sure the patient is actually paying attention. The patient is capable of sustained concentration. Because if they're not, they have a confusional state and you look for infection and metabolic disease, you don't think about dementia. You can usually get a good handle on that just from how the patient behaves in a consultation. But if you're testing it formally, counting backwards from 20 to 0 is a very good thing to do. If someone can do that, you can be fairly sure they're not confused or delirious, and you can then proceed with the rest of the examination. Please, will you count backwards from 20?
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6.
The next thing you want to know is whether the patient means the words that they say. So you test for dysphasia, the internal knowledge of language. And it's a good thing to be ready with the things you're going to test for. Otherwise, if you're not careful, you find yourself using your body parts, which is not so clever. I usually carry a fountain pen for the sake of dysphasia testing, and also a wristwatch, and the component parts of those pieces are quite useful at picking out whether patients are able to use language properly. What do you think this thing is?
Pen, a fountain pen?
That's right. What's the thing on the end called?
A nib?
And what's this bit here?
Clip.
That's right. And what's this thing?
A watch?
What are the things that move round and point at the numbers?
Hands.
And what's this knobby on the side?
A wind up.
That's right. And what's this thing?
A strap.
And what's this bit?
Buckle.
Very good. Then I look for verbal fluency, and I ask the patient to say the names of as many animals as they can think of. You don't tell them how long. A minute is quite long enough, and it's usually obvious within half a minute whether they can do it. Tell me the names of as many animals as you can think of.
Dog, cat, mouse, pig, sheep, cow.
So
llama,
patients who have a dysphasia will say dog,
elephant, tiger,
cat.
parrot, pigeon,
Did I say dog?
seagull,
And you know you're in difficulty.
dolphin, whale, goldfish, bison.
That's very good. But if they get a bit stuck and you think they're okay, ask them to go around the zoo or the farmyard, and quite quickly they will generate animal after animal, and you know that they can find words. Beyond that, I ask them about recent news. And of course, we often kind of a blank when it comes to recent news. As we speak today, the news is of flights from Sharm el-Sheikh and whether the Russian airliner was blown up or came apart of its own accord. It's all over the papers. You could hardly miss it. Do you know anything that's been in the news recently?
Yes.
Tell me.
The plane that exploded in the sky recently.
Where was that?
I think it was flying to Russia from Sharm el-Sheikh.
And what has been the consequence of that for British people?
They're having trouble getting home, and they're having to fly them over, especially on British planes.
There are people who are simply not interested in the news, and you have to dig in other areas for that. Sport is quite useful. I personally don't like sport, but I watch the bit at the end of the news with all the goals and sixes so I can be sure who's winning the test and the football cup and things like that. Otherwise, you can go for soap operas. You can scarcely not know the name of the pub in EastEnders. Even if you hate EastEnders, oh, I don't watch that. Well, what's the name of the pub in EastEnders? Oh, I don't know. Is it the Rover's Return? Oh, I don't think it is. No. Is it the Prince Albert? No, I don't think it's that either. And they'll get there. And they'll even tell you the names of the first landlord and landlady. It's fairly hardwired, I regret to say, in most of us. Beyond that, the royal family are quite a useful source of data. Most people know their names, and you can work your way down to the younger royals. You can ask the names of their children and things like that. It's very hard not to know those things. And you can push your way through it. And the person who's got nothing to all of that, you want to worry about their memory a bit. One of my favourite tests, which doesn't help us very often in memory testing, is a thing called cognitive estimate, where you ask the patient a question to which they do not know the answer, but they can work it out. The ones which I use is how heavy is a pint of milk? How fast can a racehorse run? And my favourite one, where I got badly caught out, how many camels are there in Holland? How many camels do you think live in Holland?
As many camels as you get in a zoo, I suppose.
And how many would that be?
5.
Thank you very much. And the lady said, there are no camels in Holland. I said, what about in the zoos? There are no zoos in Holland, she said. And so I was filling in the brain scan request form, and she lives in a place called Holland-on-Sea, and all the people who live there call it Holland. My point is that you have to make your cognitive testing culturally appropriate.